Welcome to my YouTube channel Moral Teaching PNC. In last two classes we have discussed the first chapter of third semester ethics and values. What is drug, what is alcohol, what is drug abuse, what is alcoholism, etc. etc. In this class today we have discussed the extent of drug, alcohol and tobacco addiction in India. ଆମ ଭାରତରେ ଡ୍ରଗ୍ ଆଲକୋହଲ ଆଡ଼ିକ୍ସନର ମାତ୍ରା କେତେ ଏବଂ ଏହାଦ୍ୱାରା କ'ଣ କ'ଣ ପ୍ରଭାବ ପଡ଼ୁଛି ଏବଂ ବିଭିନ୍ନ ନ୍ୟାସନାଲ୍ ଏବଂ ଇଣ୍ଟରନ୍ୟାସନାଲ୍ ରିପୋର୍ଟ ଅନୁସାରେ ଇଣ୍ଡିଆରେ ଆଲକୋହଲ ଏବଂ ଡ୍ରଗ୍ ଆଡ଼ିକ୍ସନର କ'ଣ କ'ଣ ତଥ୍ୟ ରହିଛି ସେଗୁଡ଼ିକ ଜାଣିବା। ଏଥିକ୍ସ ଆଣ୍ଡ ଭ୍ୟାଲୁଜ୍ର ସମସ୍ତ କ୍ଲାସ୍ର ଅପଡ଼େଟ୍ ପାଇବା ପାଇଁ ଚାହୁଁଥିଲେ ମୋର ଚ୍ୟାନେଲକୁ ସବସ୍କ୍ରାଇବ୍ କରନ୍ତୁ ଏବଂ ଏହି ଭିଡ଼ିଓଟି ଭଲ ଲାଗିଲେ ଲାଇକ୍ କରନ୍ତୁ ଏବଂ ନିଜ ସାଙ୍ଗମାନଙ୍କ ସହିତ ସେୟାର କରନ୍ତୁ ଏବଂ ମୋ ଟେଲିଗ୍ରାମ ଚ୍ୟାନେଲ ଲିଙ୍କ୍ ମଧ୍ୟ ମୁଁ ଡେସ୍କ୍ରିପ୍ସନ୍ ଦେଇଦେଇଛି, ଚାହିଁଲେ ମଧ୍ୟ ଜଏନ୍ କରି ସମସ୍ତ ଇନଫର୍ମେସନ୍ ପାଇପାରିବେ। ତ ଆସନ୍ତୁ ଆରମ୍ଭ କରିବା ଆଜିର କ୍ଲାସ୍ଟି।
In the above section, we have deliberated upon various conceptual aspects of drug and alcohol addictions. In the subsequent paragraphs, we will discuss the extent of the drug and alcohol addiction in India at the present time. Although the use of various psychoactive substances such as alcohol, cannabis, and opioids has been observed in India for centuries, the current dimension of the extent and pattern of psychoactive substance use and the problems associated with their use are not well documented. According to data on the global situation, the three most commonly misused substances are alcohol, opium, and cannabis. More men than women are addicted to them. Particularly in recent years, heroin addiction has seen a sharp increase. By injecting drugs, a person runs a significant danger of contracting additional diseases and health issues such as AIDS, that is, acquired immune deficiency syndrome, as well as death from some of these issues and from taking an overdose. Earlier, addiction was simply a problem for a select few people, but today's users come in all shapes and sizes. In reality, it is becoming more common to use multiple drugs at once, such as mixing alcohol and narcotics. Alcohol and other substances are being experimented with at younger ages than in the past. Due to rising prosperity, contemporary life's stressors, widening economic and social disparities, and a growing sense of discontentment with one's life, the issue is slowly getting worse in India, affecting both urban and rural communities. Recently published report Magnitude of Substance Use in India 2019 presents the major findings of the National Survey on Extent and Pattern of Substance Use in India commissioned by the Ministry of Social Justice and Empowerment. Government of India in collaboration with the National Drug Dependence Treatment Center, that is NDDTC, All India Institute of Medical Science, AIIMS, New Delhi, in terms of proportion of Indian population affected by substance use. Here, substance use means the use of alcohol, drugs, etc. The survey finds that there is widespread substance use among all demographic categories in India, although adult men are disproportionately affected by substance use problems. This survey also shows that there are significant differences in the extent and prevalence of use across states and among different substances. Indians most frequently use alcohol as a psychedelic substance among those included in this survey. Between 10 and 75 years old, 14.6% of the population nationwide uses alcohol. In terms of absolute numbers, the country has roughly 16 crore alcohol consumers. Men use alcohol at a rate that is significantly greater than women. There are 17 alcohol using men for every woman who drinks alcohol. So, for the percentage of women and men consuming alcohol, that is 17.1. ଗୋଟିଏ women ଅନୁପାତରେ 17ଟି men ସେମାନେ alcohol consumption କରୁଛନ୍ତି. Spirits or Indian made foreign liquor approximately 30%, and country liquor, sometimes known as Desi Sharab, are the most popular alcoholic beverages among drinkers. The states with the highest rates of alcohol use include Goa, Punjab, Arunachal Pradesh, Tripura, and Chhattisgarh. Cannabis and opioids are the second most popular drugs in India after alcohol. A total of 3.1 crore people, or about 2.8% of the population, report using cannabis products in the 12 months prior. The authorized form of cannabis, that is bhango, and other illicit cannabis products were further distinguished in terms of cannabis consumption, that is ganja and charas. About 2.2 crore people, or about 2%, were found to use bhango, and about 1.3 crore people, that is 1.2%, were found to use illegal cannabis products like ganja and charas. Uttar Pradesh, Punjab, Sikkim, Chhattisgarh, Delhi are the states with the highest rates of cannabis consumption. According to the report, a sizable percentage of people take sedatives and inhalants. Approximately 1.18 crore Indians aged 10 to 75 years, that is which is 1.08%, currently take sedatives, that is non-medical and non-prescription use. The highest rates of contemporary sedative use are seen in the states of Sikkim, Nagaland, Manipur, and Mizoram. However, the top 5 states with the highest sedative use rates are Uttar Pradesh, Maharashtra, Punjab, Andhra Pradesh, and Gujarat. Inhalants overall prevalence, that is 0.7%, are the only category of substances for which the prevalence of current use among children and adolescents is higher than adults. Other categories of drugs such as cocaine, amphetamine, type stimulants, and hallucinogens are used by a small proportion of country's population.